Hello, my name is Gillian Schweigert. I'm a nurse working in primary care at Clarendon Lodge in Leamington Spa. I also hold the role of lead nurse for the primary care network in Leamington. One of my roles involves management of long-term conditions for people with diabetes in our community, both at our practice level and at the PCN level. COVID has brought some challenges with this cohort of patients. Obviously, there's some hands-on things we like to do annually, which is foot checks and blood draws and blood pressure checks, eye checks, etc. Which obviously during lockdown became a challenge, so we had to get very creative about how we still kept up annual monitoring. We quickly thought about how we could reduce footfall to the primary care area and invited patients to come in at social distancing and various things in place to keep them safe in the doctor's office. We managed to do foot checks and weights and blood pressures and blood tests, etc., all at one time to kind of prevent them from being at risk of COVID. That was followed, once we had all those measurements in place, by a telephonic follow-up with the practice nurse. So COVID really brought some challenges, but we found a way around it. I think it's important for people with diabetes to remember that these annual screenings are still very important, even though we have lockdown restrictions and fear of catching things. We're extremely safe in our GP offices. Everybody social distances. We have many things in place to keep you safe. It's probably one of the safer places to be, actually. So we just want to say we're still here, we're still doing annual screenings, and it's extremely important that patients still keep up with that.